Today I'm going to talk about pneumonia. Pneumonia is an infection of the lower respiratory tract that affects the bronchioles and the alveoli. The most common cause of pneumonia is bacterial. Other causes include fungal and viral infections. Pneumonia can also be a secondary infection to a person who is experiencing an upper respiratory infection as well. Other risk factors include advanced age, patients who are immunocompromised, people with underlying lung disease such as COPD, patients who are alcoholics or have an altered level of consciousness that they may have difficulty swallowing and be at risk for aspiration, patients who are intubated, malnourished, and immobile are also at risk for contracting pneumonia. There are a few classes of pneumonia. The first is community-acquired pneumonia, which is just what it sounds like. People out in the community who are infected with pneumonia are transmitting these germs to people who are uninfected, and therefore they then become infected with it. There's healthcare and hospital-acquired pneumonia. This occurs when patients are hospitalized for a different diagnosis, but they are perhaps immunocompromised or just at higher risk of being in the hospital, and they are easily infected with opportunistic organisms. The other is the ventilator-acquired pneumonia. This occurs when patients who have endotracheal intubation, it can occur with suctioning that is not done in a sterile manner, or just not performing bronchial hygiene as often or as appropriately as it should be done. Transmission of pneumonia occurs when microorganisms from an infected person are transmitted to an uninfected person, either via sneezing, coughing, or inappropriate or ineffective hand washing techniques. Patients who are infected, say in the hospital, and their caregiver doesn't wash their hands appropriately, they can take that microorganism into a room of a patient that doesn't have it and transmit it to them through touching. Important things to note when you're assessing your patient for pneumonia is to ask about their respiratory history, if they perhaps have any allergies or asthma, if they're getting over a cold or an influenza virus, if they have any underlying lung disease, asthma, COPD, if they've been exposed to anyone with tuberculosis or other respiratory illnesses. Ask your patient if they have a cough, and if they do have a cough, what their symptoms are like, how frequent is the cough, is there anything that helps the cough, makes it better or worse. Generally with an acute infection like pneumonia, the cough is continuous and there's really nothing that helps alleviate that cough. Also ask if they're having any sputum. White, clear sputum often indicates a viral pneumonia infection, whereas yellow-green sputum may indicate a bacterial pneumonia. You'll want to ask your patient if they've had fevers, which is common with a pneumonia infection. If they're having fatigue or chills. Some patients will express some pain in their thoracic area from coughing. This excessive coughing is caused by inflammation of the pleura in the lungs, and it can become very sore. If they do complain of this pleuritic chest pain, though, it is important to make sure that it's not cardiac in origin and that it is from the pneumonia itself. You should take vital signs on your patient. If they have a fever, make sure to make a note of that. Physical findings, you'll find that your patient is often tachycardic, just due to the infectious process itself. They may be tachypneic or have dyspnea or shortness of breath with exertion. Lung sounds, you will find some inspiratory crackles. You may even hear pleural friction rub, which is secondary to that inflammation of the lower lobes there. You can also find decreased or no breath sounds in the lower lobes, and that could be due to consolidation of infectious debris that has accumulated and is sitting in those lower lobes. If consolidation is present, that means that the alveoli are filled with this fluid and debris, and this results in a decreased surface area for those alveoli, which limits oxygen exchange. So you may find that your patient is a bit hypoxic, hypoxemic, and may require some oxygen. Their saturations you may find are decreased. Tests that can be done to diagnose pneumonia, your physician may order a white blood cell count that is generally elevated in someone with an infection. Chest x-ray could show that consolidation or those patchy infiltrates of the lower lobes. Sputum cultures are taken to see if they can determine if it is viral versus bacterial. Often sputum cultures, however, though, can be contaminated with just normal oral flora. So if that's the case, they may want to do blood cultures to see if there's a viral or bacterial source coming from the blood. If your patient is experiencing severe respiratory distress and is not able to ventilate, oxygenate themselves, they may need to be intubated or have a bronchoscopy, not only for diagnosis purposes, but also to just kind of clear out some of that fluid and debris from the lungs so that they are able to exchange the oxygen the way they need to. Treatment of pneumonia includes, if it's a bacterial cause, antibiotics will be prescribed. Your physician may also prescribe bronchodilators to try and increase that surface area, open up those airways. If consolidation or infiltrates are present and causing hypoxemia, your patient will most likely need to be, if it's severe, need to be hospitalized and oxygen will be needed. If they are hospitalized, vital signs, respiratory, cardiac assessments, heart, lungs, that will need to be assessed on a frequent basis. Patients may need to use incentive spirometry to help kind of open up those airways as well. They also may need frequent positioning, postural drainage techniques, and even some chest physiotherapy to try and break up some of that fluid and consolidation and open up those airways. All right, so now I'm going to do an assessment on a patient coming in with respiratory symptoms. Nice to meet you. So the medical assistant over at your back took your vitals and said you were experiencing some respiratory problems. So we're just going to kind of go through some questions, if that's okay.
Okay.
All right. So how long have you had your symptoms?
I just had this cough. It just seems like it won't go away for 3-4 days, maybe a week.
Okay. And have you noticed that anything helps with the symptoms from your cough, like sitting differently, or is it worse in the morning or in the evening?
It's pretty constant. It doesn't change much.
Okay. And are you coughing anything up?
Yeah, I've got some phlegm.
Okay. Does it have any color to it, or is it clear? Or?
Yeah, it's yellow or green.
Okay. Have you been experiencing fevers? Because I see you do have a low-grade fever here this morning.
Last couple of days, my wife said it's been 102, 103.
Okay. Any body aches, fatigue, chills, anything like that?
Yeah, it seems like I'm just run down and I can't warm up. I can't get comfortable. My ribs hurt, I think, from the coughing.
Okay. So as far as your personal history, do you have any seasonal allergies?
No.
Do you have any lung disease that you've been diagnosed with, like
No.
asthma?
No asthma.
Nothing like that? Okay. And have you recently been exposed to anyone who may have had a respiratory illness?
My wife just had the cold a couple weeks ago.
Okay. But that's since resolved for her?
Yep, she's good now.
Okay. All right. Well, I'm just going to take a listen to your heart and your lungs. Okay. I'm going to have you take some nice deep breaths in and out. Okay. Well, like I said, your vital signs this morning showed that you do have a bit of a low-grade fever, and your oxygen level was a little bit low in someone, otherwise healthy and your age. So I am going to just go talk to the doctor and let him know, what we've talked about, and he'll be in to see you and kind of put everything together, and we'll try to get this sorted out for you, okay?
Okay, thanks.
Thank you.